So RN specialty practices allow for care to be delivered within the community when we do not have other care providers readily available to do that work. So we have obviously done it with vaccinations initially and with the INR monitoring and warfarin titration, but I see it as an integral role, really, especially with our current state of our healthcare being very focused on tertiary centers. We want to be able to deliver care to people within their community without needing to transfer them out. And one way to do that, especially in the north and rural and remote locations, is to have registered nurses competent and trained to provide services that are approved through their employer through RN specialty practices in a safe manner. So I'm a nurse practitioner working in Stanley Mission within the Lac La Ronge Indian Band. Stanley Mission is a northern community where we provide primary care services as well as emergency on-call services to the community. I have been working there for almost 4 years, and my educational background is that I did my undergrad through the NEPS program. I was a graduate of 2007. I worked a variety of rural, everywhere from rural to operating room emergency services, but my passion laid in rural and remote healthcare. I then went into the nurse practitioner program and have been a nurse practitioner for the last 5 years. I work within a team of very well-trained registered nurses with additional authorized practice in Stanley Mission. RNSPs were something that were definitely not well known amongst most of my colleagues, whether it was registered nurses or the physician group. Once we implemented the INR monitoring and warfarin titration RNSP, it became very evident how collaborative we could work alongside with registered nurses with additional authorized practice, nurse practitioners and physicians, and ultimately helping the patient achieve their care goals in a more timely fashion. Once we saw that this was able to be safely rolled out and had full support of the La Ronge Medical Group, who we consult with as a physician group, they were able to see how this benefits the overall care of the patient and ultimately having the right provider providing the right care. So the other part to that is that once the registered nurses saw how this rolled out and how we can safely do this, there did definitely pique an interest to go further with this. So when the opportunity came up for the vaccinations, it was something we were familiar with already, and we were able to go forward with it in a very timely fashion. There has been further discussions about what else can we do as RNSPs, which I think is great. And, you know, the excitement is starting to get going, and I think there's definitely more we can do so that we can deliver more timely care to the community. Consulting with elders was a resource that I had not been familiar with prior to in any of my nursing practice. Within the RN specialty practices, there is definitely a strong cultural component that we had the benefit of having registered nurses who are from the community to provide some input, but also having the elder to consult with and get ideas from was definitely beneficial and an integral part of the process. The knowledge and the standpoint that the elder brought to us was things that we maybe didn't always see as a healthcare provider standpoint, and more from a patient standpoint, and those things were highly valued and implemented within the RN specialty practice. One thing that I absolutely love about my job is the people that I work with every day. The community is as beautiful as the people within the community are as beautiful inside and out as the surroundings on which they live in the Shield area in Stanley Mission. There's not a day that goes by that I don't learn something from the individuals. They just bring a point of view to life that I couldn't get from anywhere else in life. So I truly appreciate the experiences I get within the community.